Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Fatigue and chronic fatigue syndrome. Introduction.
Everyone experiences fatigue at times. It can happen after intense exercise, emotional stress, or mentally demanding tasks. Not getting enough sleep can cause temporary fatigue. Chronic fatigue syndrome is a disorder that causes extreme fatigue after only a small amount of physical or mental effort.
Chronic fatigue lasts longer and is more intense. It is a nearly constant state of weariness. It develops over time, diminishing your energy and mental capacity. Fatigue at this level affects your emotions and your sense of well-being.
This program explains fatigue and a disease called chronic fatigue syndrome. It discusses the causes of fatigue and when you should see a healthcare provider for treatment.
Fatigue. Fatigue is a feeling of a lack of energy and motivation. It can be physical, mental, or both.
Fatigue is different from sleepiness, but it is often accompanied by a desire to sleep.
Apathy is a feeling of indifference or lack of motivation. It may happen along with fatigue. In some cases, fatigue is a symptom of an underlying problem that requires medical treatment, but most of the time fatigue can be traced to one or more of your habits or routines. Fatigue is common. About 20% of people have fatigue at some point in their lives that is intense enough to interfere with their daily activities. Causes. Taking time to discover the reasons you feel fatigued is the first step toward relief. In general, most cases of fatigue may be attributed to one of three areas: lifestyle factors, medical conditions, psychological problems. Feelings of fatigue often have an obvious cause, such as alcohol use, excessive physical activity, inactivity, lack of sleep, unhealthy eating habits.
Fatigue may also be caused by caffeine use. Caffeine provides temporary feelings of energy, but when the effects of caffeine wear off, you may feel even more tired than before.
Constant exhaustion may be a sign of a medical condition or underlying illness. If you always feel fatigued, it may be caused by anemia, cancer, diabetes, emphysema, heart disease, liver or kidney failure, overactive or underactive thyroid, obesity, restless leg syndrome, sleep apnea. Fatigue could also be caused by certain medicines, such as antidepressants, antihistamines, which are used to treat allergies, blood pressure medicines, cold remedies, cough medicines, heart medicines, prescription pain medicines. Fatigue is also a common symptom of mental health problems, such as anxiety, depression, grief, stress.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Chronic fatigue syndrome.
Chronic fatigue syndrome, CFS, is also known as myalgic encephalomyelitis, ME, systemic exertion intolerance disease, SEID, or ME-SEID. It is a disorder that causes extreme fatigue. This fatigue is not the kind of tired feeling that goes away after you rest. Instead, it lasts a long time and limits your ability to do daily activities. Symptoms of CFS include depression, exhaustion after mental or physical activities that did not used to bother you, fatigue after sleep, headaches, mild fever, muscle aches, short-term memory problems, sore throat.
CFS is hard to diagnose. There are no tests for it, and other illnesses can cause similar symptoms. Your healthcare provider has to rule out other diseases before making a diagnosis of CFS. No one knows what causes CFS. It is most common in women in their 40s and 50s, but anyone can have it. It can last for years.
There is no cure for CSF, and the cause is unknown. Treatment focuses on lifestyle changes to reduce exhaustion.
Self-care at home.
Many people can take steps to help prevent and control fatigue. Healthy lifestyle choices may help with temporary or chronic symptoms. To control your stress, take time to do activities you find relaxing. You can meditate, read a book, take a bath.
Drinking less alcohol and caffeine may help. Eat a healthy and balanced diet. Stay hydrated by drinking plenty of water.
Create a regular daily routine that does not wear you out. Graded exercise for CFS involves starting with a little exercise, such as light stretching, and gradually increasing how much you do over time. Too much exercise can make the symptoms of CFS worse.
Avoid social isolation. Do things you enjoy with family members and friends. When to seek help. Seek help from a healthcare provider if you have felt fatigued for 2 or more weeks despite eating a healthy diet, drinking plenty of fluids, making an effort to rest, reducing stress.
Seek help from a healthcare provider right away if you feel fatigued and you experience blood in your stools or vomit, pain in your head, back, pelvis, or abdomen. Get emergency medical care right away if you experience fatigue along with chest pain or shortness of breath, fainting or feeling lightheaded, a fast or irregular pulse. If you are having thoughts of hurting yourself or others or ending your life, talk with a healthcare provider or crisis counselor.
Treatment.
Your healthcare provider may prescribe medications to help with CSF. These may include pain medication such as ibuprofen, antidepressants, or medication for anxiety. Counseling may help people with fatigue or chronic fatigue syndrome feel more in control of their life and find coping strategies. Attending a support group may also help. Regular follow-up care helps your healthcare provider see how well your treatment plan is working. Your treatment plan may change over time.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary.
Everyone experiences fatigue at times. It can happen after intense exercise, emotional stress, or mentally demanding tasks. Not getting enough sleep can cause temporary fatigue. Chronic fatigue syndrome is a disorder that causes extreme fatigue after only a small amount of physical or mental effort. Chronic fatigue syndrome, CFS, is also known as myalgic encephalomyelitis, ME, systemic exertion intolerance disease, SEID, or MESEID. It is a disorder that causes extreme fatigue. This fatigue is not the kind of tired feeling that goes away after you rest. Instead, it lasts a long time and limits your ability to do daily activities.
In some cases, fatigue is a symptom of an underlying problem that requires medical treatment. But most of the time, fatigue can be traced to one or more of your habits or routines. Taking time to discover the reasons you feel fatigued is the first step toward relief. In general, most cases of fatigue may be attributed to one of 3 areas: lifestyle factors, medical conditions, psychological problems.
Counseling, medication, and follow-up care can help people with CFS cope with fatigue and improve their quality of life. Thank you for using Explain.